Good morning. Give me a second here. I'll unmute everybody if I can figure out how. Hi, Sharon Lee.
Hey, Clayton, how you doing?
Wait a second, a camera? This is crazy. What's going on?
Yeah, this is my personal computer.
Oh, awesome. Hey, so quick question, and I just admitted Soph too, and I'm just looking for the other two board members. Your presentation, the one that you sent last night late, that was 13 slides long. Were you going to go through all of those? Was that the plan, or was that to share with folks?
Well, I was told I had 10 minutes.
Yeah, so I mean, I can bring them up. I just wanted to know if and you can just, I only have it as PDF, so I can scroll through if you tell me which slides to go to.
Yeah, if you want to just start at the beginning.
Yep. Okay. So so I will do that, and I'm just the whole thing will be recorded, so there's going to be a little clunkiness shifting in between those. Hi, Becca. So okay, and then I was looking for Kelly. I was trying to get Kelly in here too. So Becca. I'm going to bring her slides up, and she said she has 10 minutes, so she'll tell me which slides to kind of scroll through for that.
Sounds good.
All right, I don't see Kelly yet. So I'm going to, it's 9:30, so I was going to get ready to add everybody in. Are you guys all ready?
I have 9:28.
Yeah.
I have 9:28 also.
And you can hear me okay?
Yeah,
Hi, Sharon Lee.
Yeah,
Hey.
you sound great, and it's very exciting. Yeah. So, and Sharon Lee, one other thing, we had gotten a copy of the PPE document from the Department of Health that was just released recently on the 17th. Have you seen that yet?
I haven't looked at it.
Okay, so it came up in the discussions with our coalition with all the nursing organizations.
Yeah, good.
And so just wanted to let you know that that's linked in this document, and it has information about PPE from many different levels. So we wanted to get that out there because we think that will probably garner some conversation for what kind of PPE and stuff would be needed for when we re-entry into school, and some expectations, at least building on what might be required. But I wanted to just
so was that a HAN? Because I've been looking at the alerts and it didn't come out in the alert. So
no, it wasn't. It was actually I think between the SEOC and the HOC, Eileen Gerling, the acting president of the ANA, is on those calls, but she's having direct conversation with Sherling and with Batsy, and between those conversations, she was provided this document that Michelle and Carol Conroy and some others have commented on, because there's some concerns about reuse of N95. So they've been in that. But I just wanted to let you know that that document's in there. Okay.
So there was a new FAQ that was released internally, so it probably has that as well, and I can find that. I won't be able to find it right during the meeting unless you guys continue. I'll look it up after you on. But
all right, so it looks like it's 9:30. So I'm going to admit everybody, and Becca, I will. We'll start. I'll share my screen in just a second, but we'll see faces and stuff start popping up. Okay, so here we go. We're admitting everybody right now, and just know that anybody that I unmuted, if you can mute again, if you're not speaking, just to make sure, that'll be awesome. And Becca, you're up.
Hi, everyone. Thanks for coming to our first town meeting. Today's format is a little different based on feedback from everyone around the state. And I sent an agenda in your invite, so you should have that bulleted list. But just to review for everyone, we're going to hear from Sharon Lee, a message to the Department of Health, and some updates for about 5 to 10 minutes. And then we're going to view a presentation from Soph and Clayton, which we tried to post, but because of internet connectivity issues we had yesterday, we didn't actually get the chance to post it. So we're just going to watch it and then discuss it. And then we're going to discuss and have questions around the slideshow that was an attachment in the invitation, of different things nurses are doing around the state and each district. And then we'll follow up with some general questions about COVID-19. Please know that if you have any questions during this session, you can type them in the chat box. And if you have any questions after, and they come up after when you're thinking about it or reviewing it, if you're not actively in the meeting, please email them to covid19@vssna.org, and we will try to get the answers and post them online or address them in our next town meeting. So without further ado, Sharon Lee, please take the floor.
You're muted, Sharon Lee.
Hi, Sharon Lee Treffery, Vermont Department of Health. I don't know if I need to read that message to you. It will be in the bulletin. We can't predict what the future will hold, but we continue to assess summer and fall activities. I can speak a little bit more about that in the notes that I prepared for today, if you want to move forward to that.
Yeah, give me a sec, Sharon Lee. I'm going to bring up a different slide.
So I hope you're all doing well. And I'm kind of curious how people are doing, taking care of themselves. I know some people take care of themselves with rest and activity and things like that, but I think a lot of it is all about connections at a time like this when we're more isolated, connecting with people in other ways. And just wanted to share a little tidbit. I didn't know if you'd ever heard of the 8-second hug. Research has shown that a hug for 8 seconds increases your oxytocin, the empathy hormone. And if you can get a hug or give a hug to those in your immediate circle, your safety circle, 8 times a day, you're good to go. You're protecting your brain even with that little jolt of the empathy hormone. Okay, my objective for today, we just saw, is to have you feel a little bit more confident in your scope of school nursing practice. We can go to the next slide. All right. So just a little bit of update. I'm talking about access to care in relation to school nursing. And I won't go over the resources, they're in the reference, but I've curated them for content that really is relevant to school nurses. Let's go back to that, stay on that slide there. And because the prompts that you see on the right side of the screen, what does your current office hours look like in terms of helping students and families access healthcare? What would a warm handoff to the doctor's office look like? So that's how the access to care focus around school nursing will proceed. So the next slide, if you would. Thanks. So here's some quick updates. Pediatric testing is now a thing. If you've gotten your Health Alert Network notice, it is still a nasopharynx. You know, it's pretty obnoxious test to stick the swab way down in there. They're actually working on trying to get outer just in the nose itself, but that's a test. They're testing that process to see if they can do it reliably and get reliable symptoms. So that's not available yet. It's still the nasopharynx swab that is needed for anyone, adults included, currently, but there's an increased focus on pediatric testing, and the priorities for kids who have symptoms with mild to moderate disease should be given to children. So that's the priority. Children of healthcare workers, children with chronic underlying health conditions, kids who live in congregate housing, kids with exposure to a patient with COVID-19. But as always, the clinical judgment is up to the healthcare provider to make that recommendation or make that assessment that the COVID test is needed. But I'm just talking with Brina this morning. She's encouraging people to, let others know that that's an option if it works for the provider. The testing is still recommended to be done at a testing site. And the purpose of that is to save PPE, minimize use of PPEs. Thanks. So, because that means that to be seen in a provider office, that's a use of PPEs, and then to go to the testing site is another use of PPEs. So they want to do as much telemedicine as they can and send the child to the testing site only, is the preferred method. Let's see, the cleaning products, the reason that's on the slide is because the calls to poison control have increased 20% during closure of schools. So a little anticipatory guidance with any families that you're in touch with would be helpful. Let them know to use products safely, lock them away, and make sure that people read the label. Frequently asked questions. So that document is still, staying in the same slide. There's a tool. If you haven't used it already, if you click on that link, it says Ask a Question tool. When you're done with the slides, it will take you to a bot that scans the FAQ document and finds the answer to what you're looking for. So what do I do if I'm in close contact with someone who's waiting for their test results? That was a new question added to the FAQ the other day. And I hope you all know that if you are a close contact for someone who is ill with symptoms of COVID, you quarantine until their test results come back. And then go from there based on those results. Okay, next slide. So we're in the recovery phase. You probably heard the governor say, phase 1. We're trying to flatten the curve. They're very excited about the progress made there, which is why we're able to maintain PPE supply and hospital beds and things like that. But how do you get the next phase 2 is state by state reporting. It's when we have a better understanding of the disease transmission, like really getting into the discrete details of why some family members of COVID-19 positive patients do not get the disease in the house, and yet in other households, members of a family member with a positive test do also get COVID-19. So understanding some of the epidemiology as to what prevents illness. Testing of medications is still a possibility, medications that can be used to treat COVID. There are no current available approved medications for that. It's in the process. Phase 3 is when vaccines are possible. We'd have to move to, hope for herd immunity. The system would need to be, put in place so that to increase vaccine uptake. And of course, that's when lifting physical distancing might be possible. And phase 4, of course, is rebuilding for the next pandemic. Okay, next slide. So how do we decide when to move to phase 2? A sustained reduction in cases for at least 14 days. Hospitals are in the state are safely able to treat all patients that need care. The state is able to test all people with symptoms, and the state is able to conduct active monitoring of confirmed cases. Next slide. So for those of you who are doing office hours, I don't know if I probably don't have time to hear a lot of what you're doing. I know some of you are doing it. I know nurses around the country are doing office hours. What do you do every day when kids are in school? It's the same kind of conversations that you might have with families, although maybe the conversation expands to family members. Maybe the grandmother has a question or the father. So you're consulting by video using your nursing diagnosis, cracked skin between the toes. So your nursing guidance would be to assess the current foot care procedures at home, be sure they have their feet are washed and dry socks, dry shoes, you would give them the anticipatory guidance as to when to see the doctor. You're not providing a medical diagnosis, and nor are you ever asked to. Another example would be, okay, you've got a kid with a fever, a rash, they've been playing outside. They've been helping stack the wood. They've been running through the woods in the fields. They have fatigue, joint pain, muscle pain, and headaches. So you assess a little bit more, ask questions. Maybe you could see the rash. Maybe it's localized in one place. You know, you might be concerned about whether the child has Lyme disease. So you'd be helping them make an appointment to the doctor's office. A warm handoff. What would a warm handoff look like? How will you know until you reach out to the medical providers in your area? How will you know what their office hours are? What are the safety precautions they're taking for COVID-19? The reason I bring this up is you've heard on the news and we hear in meetings that primary care visits are down, and partly because people are afraid, not necessarily because they are less well. And just like kids who are sick in school or kids who have underlying health conditions, they still have the same things. And those underlying health conditions are still affecting kids' learning when they're home. So helping families understand when and how to get to the primary care office will be important. There are providers that are providing annual well care visits in kids who are older than 2 years old. So they're providing them to infants under 2 as well, for sure, already in their practices. So this might be a time, again, it would be finding out who in your area is opening up for well care visits. That might be a time to those kids you know that are behind on immunizations. But it means reaching out to those providers and finding out what works for them. Telehealth, and by that I mean the medical provider who's licensed to provide medical treatment and care would set up a meeting, and that might be, and I think we talked about this last week, that might be a time when you could help facilitate a care coordination meeting with the family and with other school personnel even, and the medical provider. Next slide.
Sharon Lee, you have 1 more minute.
All right, perfect. So having health office hours it's kind of the same thing you did when you were in school. Can they stay? Do they go? And how do they get there? Next slide. So I was really sad to think that some felt that they weren't essential. School nurses are essential, and the only way that schools are going to get back to having in-person learning. So whatever you can do to help children and families and personnel stay well today will help them be ready for learning tomorrow. And that is it. Next slide. You can just go through. That's a, by the way, just read that about paper books and handling. And then resources down here, kind of a curated update and some good news at the end. So thank you. I'll mute.
Thanks, Sharon Lee. So next up we have a presentation that Clayton and Soph made that we'll all watch. It's about 12 minutes. And then we'll have discussion and questions about the presentation.
Good morning, school nurses of Vermont. This is Soph Hall, president of the Vermont State School Nurse Association, and Clayton Wetzel, the NAFN director from the state of Vermont. We wanted to share with you a few things that have been going on regarding returning to school in the midst of this pandemic. So, did you move your slide, Clayton? I'm sorry.
Yeah. So,
Okay.
hi, this is Clayton.
Sorry.
This is Clayton. And we are looking at some high-level items for school reentry considerations. And one of the most important things is that we get the school nurses and the school districts at the highest level to speaking with administration about how this is going to work. It's a healthcare issue that the nurses need to be involved in this. So obviously district level planning. We want to be able to help with the planning, the execution, and the continued operations. And
Clayton, I think you have to turn your mic back on for us to hear the slideshow.
IS 200, which is Basic Incident Command Systems for initial response, IS 700, which is an introduction to the National Incident Management System, and IS 800, National Response Framework. Those last two, 700 and 800, are what most superintendents or facilities managers, those are the courses they take so that they have a basic understanding of the whole process. And if we also know what they've learned, we can learn the language that would make sense to them so that we can be more influential in how we promote all of the different healthcare and nursing needs that we're pushing forward. It also means that we need to be coordinating with the Department of Health, the Agency of Education, using NASN as a tool, using the VSSNA as a communication piece, and for data gathering and for many other parts of that. So if we're using that concept, we'll all be sharing in the same information, and the plan would be, if we're able to do that, we can then go to the role of the school nurse. There would be things like our expectation. We need to collect data. Is there going to be vaccinations done in the school for instance, for kids that are non-compliant? Or would we do a vaccination clinic at schools for either COVID-19 vaccine once it's available? And the other part of that would be is with folks that have religious exemptions, would they be able to do a religious exemption for COVID-19 once it's available? Once that actual vaccine is available for giving, will it be mandatory or not? Those questions are coming up and we would need to be resolved. And then surveillance. So we would need to do case management from now, possibly through the all the way when folks start to re-enter the buildings. What's it going to look like? Do we have exclusionary responsibilities? If we once we start coming back to school, do we have an area to isolate sick folks? How are we tracking symptoms? What personal protective equipment are we going to be required to purchase, to store, and to use? And who's using which? Is there going to be cloth face masks? Will we have to have surgical masks? Is there a point in time when we might need N95s? And then the other part of what we would be doing, and part of the reason we're doing these webinars and town halls and all of the other informational meetings, is so that we can be trained in what COVID is and what the expectations are going to be, so that we can then teach our staff, students, and the community about those. And I'm going to turn it over to Soph so she can give you a little more detail and then next steps.
So some of the things that we are looking at needing to identify is what exactly do we need in our healthcare office and how do we prepare for those needs? So some of the things that we are anticipating is we may need to address more frequent visits to the health office. Again, PPE that Clayton mentioned earlier. We may also need to be looking at what kind of equipment different from what we have now, if the expectation of the nurse role in assessing particularly COVID-19 over the next school year, what that's going to look like. We're also going to need to identify the risks and be aware of how that might impact the students, the staff, and certainly us as the school nurse. We need to make sure that we're going to have increased availability for staff and students for dealing with mental health and counseling issues. Just so you know, the questions that have been raised by this group in the last couple of weeks regarding how do we return to school were very timely. Right around the same time, both Clayton and I had received guided information from NASN requesting some input as they are assessing what needs to be done and writing a guiding document. Once that is done, we will plan to use that as the VSSNA to translated into how it will work for us here in our state. The plan will be that we will be coordinating all school nurses with the Department of Health and the Agency of Education. What we're going to be looking for is consolidating different ideas, documents, other information so that we can offer statewide guidance and it won't vary dramatically from one district to the next. We are looking at a joint statement to be written with us and the Vermont Superintendents Association, similar to one that we are working on currently regarding the joint statement and the surge support. I'm going to turn this back to Clayton to share a little bit about our COVID-19 surge support document.
And so just as recent as yesterday afternoon, Soph and I both provided input onto the letter that's being written by the VSSNA, the Department of Health, Superintendents Association, and the Vermont NEA. And you can see the purpose down there, but it's to give a unified and consistent recommendation to all superintendents and principals on what would the expectation be if a school nurse chose to work out at a healthcare facility to whatever they were comfortable with. It gives them the ability to do that, knowing that they actually still have a job and they're still working within their school district, but they're able to do this additional volunteer, whether it's paid or unpaid, work at a healthcare facility or elsewhere. It could be phone calls, whatever. The idea behind this is to make sure that school nurses are empowered to know that they have the ability to do this, that it's not going to come back on them if something was to happen with if they were working in the hospital and an injury occurred or something like that. That's not going to affect their job. This document provides that detail. It's not done yet, but it's very, very close. So hopefully, well, one, hopefully the surge won't happen. But two, if the surge is required, and there's still some talk about that, we will have this document in place that will assist us, and then it can be the basis for it if something in the future came up. We would have this already recognized as a need, so we can move forward with that with confidence. And then Soph's going to talk just about a couple of other things with our coalition that we started with some organizations, and she will go into some detail with that.
So I am very excited, and I know that much of the VSSNA leadership is, that we have been able to be involved with some decision-making regarding nurses with leaders of other Vermont state nurse organizations, and have created a coalition, the Vermont Nurse and Nurse Practitioner Coalition. This includes members from the VSSNA, the ANA Vermont, the Vermont Nurse Practitioner Association, and the Organization of Nurse Leaders for Massachusetts, New Hampshire, Rhode Island, Connecticut, and Vermont. It's a pretty amazing group with years and years of experience, both as nurses in leadership, in policy development, and government levels as well. So stay tuned. You'll be hearing more from that group over the course of the upcoming month. I asked Clayton when he put this slideshow together to include this NASA's COVID-19 survey link. You should have received it in your email from NASA. This is the direction to give your thoughts and concerns to the National Association regarding what's going to look like when we return to schooling in the building. So I encourage you, when you have access to these slides, to follow that link and complete the survey, please. Also, ANA Vermont has instituted a huddle where you can debrief with nurses. You do not have to be an ANA member to participate in these huddles. It's an opportunity to talk about things that you have been experiencing as a result of COVID-19. You'll be able to talk with other nurses experiencing the same or similar concerns, and it will be moderated by a licensed mental health professional. And the last thing on this particular slide is a link to the COVID-19 PPE guidance from the Department of Health that was released just earlier this week. If you have not seen it, you definitely want to take a look at it. We will be needing to, again, identify PPE as we move forward with our return to school. These slides will be made available to you after today's presentation. And please continue to use the COVID-19@vssna.org email address to send questions and concerns. That's the best way to reach us and to make sure that we get the information that you would like to have. So thank you again on behalf of the VSSNA for joining us today and for your commitment to to both the school nurses in our state and to the students that you work with.
Okay. So I just wanted to mention that in the chat box, I've uploaded the PDF documents for everything that Sharon Lee presented and what Soph and I, the PowerPoint presentation, and I included the NIMS courses that I discussed in there. So, and also the next document I'm going to pull up, which Becca will speak to in just a second.
So before you pull that document up, we're going to have discussion and questions about the presentation we just saw. So is there any discussion or questions? Okay, having no discussion or questions, let's move to the next slideshow. This was an attachment on the invite, and it's a slideshow that some of the reps put together lists of what school nurses are doing in their districts. And so are there any questions about what people are doing or clarifying questions about what you might not be doing but you think we should be doing, or any questions?
So Becca, I don't know if you want me to unmute everybody and so that they can have control of mute and unmute if they want to ask questions, as long as it doesn't become a cacophony. We could try that. We haven't tried that in the past.
Sorry, I thought that's what was going on already.
No. So well, I haven't done that yet. So I'm muting everybody. And so if everyone's unmuted, so if you're not going to talk, if you could mute, that'd be awesome.
Now you all have control over your own mute and unmute. It can be found on the bottom of your
Okay, hold on.
On the phone, Clayton.
I'm sorry?
There are some people that are on phones that might not be able to.
Yeah, so
This is Jeremy Treffry. I would love to hear how folks are doing.
Because I got him on a leash.
So I'm going to ask you to mute everyone again.
You do that.
This is Jeremy Treffry. I'd love to hear what it's like for those with office hours. How is that going? Checking with families.
This is Claire. I'm not on this list, but I periodically, like every other week, will call each of my kids with a care plan. Usually end up chatting with their parents, but at least I'm checking in with them.
What are you learning from
them? Most of them seem to be pretty okay with their underlying problems. It's the general stress of being at home.
Mm-hmm.
Couple kids with asthma who as we start allergy season are having a little bit more trouble. And my advice has been basically to call their docs and see about re-upping their, if your inhaler's expired kind of questions. But that's basically the only real major problem. The only other real concern I have is a kid who had some elective surgery postponed. So he's kind of uncomfortable and waiting, and all I can tell him is to hang in there.
Yeah. I wonder if people are experiencing increased asthma symptoms because of increased cleaning and more cleaning agents. That has definitely increased symptoms for others.
So while we're waiting for that, so one of the questions on here is, what is the current feeling regarding reentry occurring in the fall? Can this occur without a vaccine, social distancing, need available testing? So Sharon Lee, I don't know if you can address that at all.
A great question. I mean, that's exactly what the, if you want to pull up the slides, I mean, that's we can't get there until we can get to phase 2. So phase 2 being having a stable disease rate. There is discussions about how to look at congregate settings with different numbers. That's just stay tuned to the governor, that those conversations happen between summer programs and the health department and childcare and the governor's office and businesses. So that's definitely a concern about how to get a number of people in, looking at numbers and spaces. Where without a vaccine, things are going to look very different. And we don't have, that's what the national conversations are about. And the message that Clayton put up at the beginning is we really don't have clear answers to when it will occur, but those are the safety pieces that need to be in place. Clear guidance around social distancing, clear guidance around numbers, clear requirements for face coverings, and capacity to keep things clean, and schedules for cleaning, and spaces for individuals who appear to have symptoms. So thank you for that patience.
And then another question was, has there been any discussions about the hospitals passing off N95s to the local schools once the schools reopen?
The question hasn't come up. That is going to be part of the overall stockpile question. But that's, it's an active question without an answer right now. So it's another stay tuned. This rapidly evolving, and the answer that you get today is going to be different from the answer for tomorrow because things are changing that fast.
Okay. And then another question is about summer camps. Is there any talk at the state level about what summer camps will or won't be available, and what the thought process would be for social distancing and PPE and all that goes along with it?
Yeah, that's a great question. I mean, again, that relates back to being able to have steady disease, defining numbers, and defining the system. So once you have these people camping in a residential campsite, what's the healthcare system that's going to back up new infections, and how are those people going to be trained? So those are all important questions that need to be built into a structure to support increased congregate activity. And it's a mental health issue, so it's very important. And people, it's a huge financial issue, it's a huge mental health issue, and it's a step towards moving back to some normality.
And so there's a statement that says, as of now, Cub Scouts and Boy Scout camps are planning to be on. Discussion about whether or not campers will need to wear masks. So it does sound like organizations, which is great. So organizations are having those discussions,
Yeah.
and hopefully those discussions are happening with medical providers and the Department of Health, and making sure that everyone's in agreement with that.
Face coverings is a yes.
Okay. So there's what office hour sites are people using, and is there just one student in the office at a time? Zoom, Google Hangout, another option.
This is Sarah Johnson, and I'm doing a Google Hangout, and I open it to the whole school for students who want to join that have medical related questions. And I seem to have a following, and they don't have medical related questions. It's more of mental health. I think they have a need to socialize and tell stories, and it's a way of them expressing and interacting with others while they're being isolated, the basic, distancing, but staying in their rooms. So it's more of a mental health social. They do bring up, I had kidney stones or I had this, but it's a lot of storytelling. And I do it for a half hour daily.
Great, thank you for that, Sheriff. That's really great. There's another question that is there going to be a follow-up on schools that don't have actual nursing offices that are either using teachers' lounges as nurses' offices, or there is no running water for being able to do washing hands and as such. So is there any discussion at the state level about helping schools that have issues like that?
The funding issue will come likely through Title I, but that is, again, not a definite answer. The state is not looking at, we don't have a definite answer. There will be guidance on what's needed. So then the school district will have to decide how to implement what is needed.
Okay, that's great. So if everybody could, if you're going to do a chat question, if you could make the chat to everyone and not just directly to me, that'd be awesome. I will get to the questions, but that way, when we save this for later, all of the chats will be available and we can make sure we address all of those questions. So thanks for that. So another question, or actually there's been a couple of comments about what's been happening. So some are using Google Meets. AOE has advised not to use Zoom for student context due to the confidentiality issues. So therefore they're using Google Hangouts. Now, I would just like to speak to that for 1 second. So in our school district, we actually have started using Zoom again because Zoom has fixed the issues of concerns about Zoom bombing and other things that had happened. They closed all those holes and loops. So I believe every school district will be looking at that and re-examining, because the Zoom platform is actually pretty powerful, but it's going to be an individual thing. And Sharon Lee could speak to the Department of Health not using Zoom, because I believe that's still true. But Zoom has fixed all of the issues that had come up, and they've been very, very quick to respond to any other problems that have been happening. And then there was a question about what about no nurse in the school, and if they're using either an unlicensed assistant personnel or LPNs in the schools. So those would be considerations. Obviously, Sharon, your thought on that?
So again, the guidance will be clear on what's needed, and the school will have to decide on how they can fill that need. There's going to be, there's a need you may have seen in New York. Somebody just said that they're hiring 100 more school nurses just for the coming year. So the demand for school nursing is only going to grow. The more you are visible, the more examples that you have, that you demonstrate of your leadership, the more likely they will be to see the need for more school nurses.
And to add to that, the National Association of School Nurses has put together a letter that we can write to our senators, actually talking about exactly that. So in the coming week, we will put out something that has that, so that everybody, all the nurses and anybody else that would be willing to, could write letters to our leadership to say how important this is going forward, to not just always be reactive, be proactive in making sure that we have nurses, school nurses to support this. And then there's a couple of questions, Sharon Lee, about summer school. And so one is, can there be summer school? And two is, if there is summer school, what steps need to be taken so that the school can be open to support that?
So that's a good question. I had a call from a teacher yesterday who is seeing kids with special education virtually because things are changing and moving towards different numbers, and the summer camp question keeps coming up, summer camp or summer school, it's kind of all the same. Again, there needs to be, we're developing clear guidance around what the safety from the epidemiology and health and safety standpoint need to be in place. So the example of the teacher that called was, and no one is allowed to have contact with students right now, according to the governor and Secretary French. But if you were to do that, what you would need to know the numbers, you need to know if you're the only adult and one child, you need to have those safety precautions in place, in addition to, again, face covering, cleaning, staying home when you're ill. What is the screening process that happens? Childcare are doing this all over the state. They're screening kids every day, and they're screening their personnel that come in. And those of you who may recall the question a couple of weeks ago about, well, why are we checking temperatures? It's not necessarily a predictable indication of disease. And Dr. Holmes spoke to that again this morning, and she said, you're absolutely right. The tests and the research they did in Washington State demonstrates that in kids, 40% or less had a fever in association with COVID disease. So it's not a predictor of disease. So those questions have to be answered before congregate sites open up.
So can I, a follow-up to predictors. Recently, they've been talking a lot about the loss of smell, loss of taste as being a very good predictor, or at least, but I don't think there's been an actual study done yet. So has Dr. Levine considered that as something that's been put into the toolbox for folks to use as a symptom?
Oh, yes, that's been validated. Okay,
great.
As I understand it, based on the documents I've read at the health department.
Okay, so I'm going to read this in its entirety, Sharon Lee. It says, we need a joint meeting as soon as possible with Dr. Levine and Kelso addressing the various non-moving targets, for example, not including timing of things, scenario and our abilities as school nurses, qualifications, office area design, etc., how we could contribute district-wide and possibly community-wide in the rural areas to contact tracing and acquire training for testing to include access to testing supplies.
Some of it.
So that might be, so we'll have that, we'll maybe, it might take a minute to process that. And so we can we'll do a follow-up when we post this video. There are going to be some questions we might not be able to address right away. That might be one that Sharon Lee needs to consider. But we'll get back to folks on that one. Is that okay with you, Sharon Lee?
Yeah, I'm just trying to understand it, non-moving targets scenarios. Yeah, I'll have to study the question. I'm having trouble understanding. I'm hoping it sounds like is how can school nurses help with contact tracing in the community related to schools, but again, I have to read it again. Thank you.
I'm actually trying to find Carol so I can unmute her. Oh, here she is. So Carol, you should be able to unmute yourself now if you want to do a follow-up to that. I think. So maybe Carol, I'm trying to unmute you, but apparently it's not working, so I apologize.
While Clayton's doing that question.
There she is. Go ahead, Carol.
Perhaps we can move to the next question while we figure that out.
Well, Carol's unmuted right now, so Carol, go ahead. Or C. Moffitt. Maybe I have the wrong first name. Okay, we'll move. I'm sorry. We'll move on to the next question.
Okay. Who will support the nurses for these changes that need to be made for isolation, et cetera, specifically when you do not have any current office isolation area at the present time and work out of teachers' lounges and no running water in there, et cetera?
It sounds like a real situation. I don't have any. We're all working at trying to make sure that kids and staff have things to keep them safe. So who can you align with in communicating with your school administration? At the same time, you're connecting with your staff and your families, sometimes finding a favorite staff personnel and favorite families that will help you advocate for spaces that's needed, because none of them want to be in an unsafe working environment or learning environment.
The next question is Vermont seeing the foot lesions now being seen as a COVID symptom for children?
No. I saw something in the paper. The only content that I know is that it's speaks to adults. I've not heard it about children.
Okay.
Again, I'm not the expert.
Yep, but okay. I am wondering if it is really safe in the short term for students with underlying health conditions to attend school.
That's a great question. We tried to address it a little bit in another town hall meeting. It's going to be a challenge. It's going to be a really difficult challenge. Again, these unprecedented times have there's no recipe for making this successful. The recipe is all of your creativity and thinking around situations that have become successful and using those as models for moving forward. There is a national group it involves CDC, the American Academy of Pediatrics, NASN, and myself, the National Association of State School Nurse Consultants, along with many other national partners, like all of the asthma, seizures, diabetes, food allergy. All of those organizations are involved in the same issue to help schools manage chronic disease with children. I can go into great detail as to a CDC grant that's spearheading that, but specifically, we were convened a year ago to move guidelines forward on much more rigorous management of helping families with kids with chronic health conditions manage them in schools. So that is a place where there will be further guidance to come.
Great. And I would like to follow up with that too, is that in the document that the NASN is working on, it does talk about those types of things. Like if there was someone that had a chronic illness or was immunocompromised, how that would look with them still doing e-learning possibly instead of coming to school and having some kind of hybrid, or at least thinking along those lines. Because all of that, obviously, especially when we go back into the fall and we're starting to think about flu season and possibly resurgence of COVID, those probabilities are there that they're the most at risk. So we have to think about that. So I'd like to turn that around. I'm sorry, go ahead.
I'd like to turn that around to all of us in this space, this under 100 people. Those of us with chronic health conditions may have difficulty returning to work if you have a situation that's unsafe. So the first thing is always to make sure that you are safe, but using that example, and I had a caller the other day, it's going to be hit or miss whether we can return to work if the right things aren't in place.
Right. Very good. Thank you. I'm going to read this one. I think this is a positive outcome of what we've been doing. So I'm going to read the post in entirety. So I wanted to thank you for the information and tips that you've been sharing. I have been sharing information with our PTO leader, who is in turn passing information via social media. I've also been struggling at home with my own child struggles and depression. I agree with that mental health is key and it's a big issue during this time. I was able to set up counseling for my child and his counselor. And is there any information regarding COVID antibody testing?
Yes, I could answer that next week to get in the details. The governor and the commissioner have been talking about that. It's a ways to go. And part of the issue is it's not like the antibody testing for flu or other things where there's a hard stop where you can definitively decide yes or no. So I can prepare for that another time.
Okay, great. And then C. Moffitt, who had asked the original question about non-moving parts, that was your question. There's kind of an update to that. So things we know we could or should be doing. She doesn't have a mic. And oh, it's Cray. Sorry, Cray. I guess Carol. And non-moving means things we can know now and we cannot know for timing of when to open, but we can prepare for other things like testing, good template for assessing, smell, taste, etc. for markers. We can actively propose and what we can do to get all corners of the Vermont to Dr. Levine and Kelso. So thank you for that, Cray, and I think Sharon Lee will still be addressing that as we move forward. The next one is in terms of transition back to school, it would be really helpful, essential really, for the Department of Health and the Agency of Education to publicly identify or endorse the role of school nurses as an essential member in conversation, collaboration with school admin teams. If the directive comes from the top down, it really helps all of us at the ground level. And if I could just say, Soph, maybe you can speak to this for a second, because I think we discussed this earlier this morning and yesterday afternoon.
This is an absolutely amazing question, and I am so glad that you've raised it. It is indeed something that we need to address, both as school nurses and as this organization. We've talked about setting up a group of school nurses that might be willing to work on drafting a joint statement, an essential statement, frankly. I'm 100% in agreement with you that in some LEAs, it seems that the school nurses are very well connected with upper level decision making in the district, and others are not. So it is something we have discussed, we are working on, and if it's something that is of particular interest to any of you, go ahead and send some thoughts either to me at VSSNA President or to the COVID-19 at VSSNA email address. And I think that it's something, it's not too early to start working on. And it is indeed something that we need to do and can do. So thank you for bringing that up. It's clear that there are lots of folks that agree with you, Katie. Messages in the chat, as well as the fact that we've been having this conversation. So I'm really excited that you brought it up, and I hope that you'll be willing to work with us in getting a statement and getting the connection. I will say that I am very pleased that over the last, not quite year, we as VSSNA leadership have been very successful connecting with the Vermont Superintendents Association. And I'm hoping that we can draw on that relationship to do just this very thing, to make sure that school nurses are recognized and identified as essential. I think those of us that work part-time are going to really need to be pushing to work to be full-time. I just cannot imagine we don't even know what we need to do for assessing a student yet. I can't imagine asking someone who doesn't have our skills to try to figure that out. So thanks a bunch for that.
So Becca, go ahead with those last two items.
Okay, so we just want 5 minutes left and do want to, we got one question to our COVID-19 email address that we'd like to address while we are all on here. And that question is, if a COVID-19 vaccine was available prior to next school year, would it be mandated for students to receive this in order for schools to accept children back into school?
Sharon Lee, you're muted.
You're way ahead of that possibility. That possibility is a long ways away.
But do you think it would be appropriate to be looking into that discussion, since we know that at some point that one, well, we hope at some point the vaccine will be available, and two, if we start pre-thinking it now, we might be able to remove any roadblocks that are going to keep that from happening, or at least having the discussion of folks who decide that they would do an exemption of some type, because that may not, we don't know about herd immunity yet, I don't believe, and how that's going to affect the rest of the population of any school or state or nation.
So there's so much work that needs to be done right now to keep people healthy and at home and isolating, that the work of that is way ahead. It requires a workforce that is tied up doing day to day and the basic planning of managing health in the state. What's more important is, and the example came up in the discussion with childcare, summer camp, is if you go to childcare, if you go to a regulated childcare, you must have a physical before you go. And that must be in the hands of the childcare provider. If you go to a summer camp, you must have a physical before you go. That means if you get there and you get sick, we know in the childcare or the camp counselor or the camp nurse knows that you have a medical provider. And that's already confirmed. We have lots of families where we don't have know that they have a reliable medical home, or that they've had a physical in recent times. They think they've been to the doctors, but there still are a lot of families that are, some of the most vulnerable, that homeless and things like that, where we still don't, a test comes back now for COVID-19 and there's nobody to report it to except for the patient, because they don't have a doctor. So those are the infrastructure that really needs to be thought through. Another thing is having, there are some states, New York is able to afford hiring medical providers to consult with the school or to be on staff in the bigger districts. How many of you have a consulting physician? And many of us do have them that prescribe epinephrine and things like that. But what other role could they play and how might that help? So those are some of the infrastructure pieces that we need to. And what about the school nurse? What about those of you who do home visiting? You might not be doing it now, but some of you do home visiting. Is that when you look at case contact and understanding the needs of kids with chronic health conditions, what role is there that a school nurse could assist with?
Cool. Thank you, Sharon Lee. So I want to grab one more statement and then anything else that's in here. Appreciate all the comments. We'll respond to those if we can, or when we can after this, and we'll get those posted. But one of the statements was, or a question was, would it make sense to form a few different committees that contribution ideas could be made regarding all the issues we are discussing? So Becca, maybe you can speak to that with the LEA and what we've been working on in the last week or so. And the only other thing I want to add is that we did have a pretty positive meeting with Senator Ash. And I think that when we start generating a letter that would go to the governor, it would also go to Senator Ash. And we can also send it to our local representatives throughout the state so they all know what we're trying to do. But all of those things are going to be really key, because the more we elevate, we have that one voice and we're really speaking as one. And the more that we're all working under kind of the same guidelines and the auspices of school health care that we're providing, and that one voice and agreement or consensus would really help us with that message. So Becca, go ahead for the closing, please.
So we are at time, and I'll just address what Clayton said very quickly about the comment of all the different committees and contributions. We currently are meeting every Monday morning with a district rep from every school LEA. And a question came up earlier about what LEA is. That is the universal term for school districts, school supervisory unions. It's the generic term for those types of district titles. So we are looking for an LEA representative from each school district. And if you are an independent school nurse or a private school nurse, we would welcome you to come join as well. If you could email COVID-19 at VSSNA, if you're interested in being that rep. We do have some people who have stepped up. That was from a poll that we sent out 2 weeks ago. And we have, there's 52 different LEAs, and we have about probably 20 or 30 people that have stepped up. Some districts have 2 reps that are sharing that. And so we've been meeting with them weekly to primarily drive what the content and organizing these town meetings. But we can certainly, with more numbers of people, we can break out into smaller committees. One of the challenges that the VSSNA has had over the last 4 years is that we've had very low involvement numbers wise, and so it's really difficult to have different committees with only 8 to 15 people on the board. So the more people that become active and the more reps we have, the more work can be done in committee work and those types of things. So that being said, I just want to close with a comment that was sent to us that a nurse said. She said, "I woke up today thinking about our United School voice here in Vermont and was wondering, how can we make a public statement about staying the course? I don't know about everyone else, but I'm so concerned about groups of people in my community who are silently and not so silently protesting our stay safe, stay at home orders as well as face covering and social distancing orders. Feel free, oh, sorry, kind of long-winded, but she's basically saying, can school nurses, how can we use our collective loving voice to firmly say, we've got to be in this together and stay safe? So on that note, we hope you have a wonderful day. Our next meeting is Monday at 8 a.m. and we will be trying to figure out the best time for the most amount of nurses across the state as we move forward for these town meetings. So thank you again for coming, and email any questions to COVID-19 at vssna.org.